Good morning again. This is Dr. Bill Wyatt with the American Orthodontic Society, and I want to cover something here before I quit doing these things. It is a strange action of your teeth by putting bonded blocks in there. You can do so many things with your teeth if you understand bonded blocks. In other words, we can open the dental bite and not raise the distance between the chin and the nose up here. In other words, not make it longer, but doing that by using bonded blocks. If you're going to open the bite, you don't want to open it dentally, but not open it skeletally, then you put the blocks back in the molar area. And these teeth will put a lot of pressure on this while you're doing it, and you can open the anterior part of the mouth without opening the back part of the mouth because of the pressure of the muscles that are chewing there all the time. And this is a strange thing. Now, I have a young man that came in, and he had a terrible crossbite. I mean, a central, we'll show you that in just a minute. And we wanted to open the bite on one side while I jumped this crossbite out and got it out. And before I could get the crossbite out, and I had to open this mouth about 1/4 of an inch. And before I got that lateral through that gap, the teeth on the other side of the mouth were in contact. I mean, they didn't get any longer, they didn't move in the bone, but the whole bony structure and everything just moved together on that side of the mouth. And so when I took the bonded block off, these teeth were touching, and I had a gap over here about 1/4 of an inch, and just left it alone, and this comes back together, and the whole thing levels out where it was. And this is something that I don't think people fully understand how this action works and everything. But let me show you this, and then you can decide yourself. Now, we've took a whole stack of pictures on this young man to start with, and just as I got him just about ready to finish up, they moved away and didn't pay the bill. So anyway, I don't have the finished pictures here, but I learned a tremendous amount from this case. So I'm going to go ahead and show this. I'll have to touch it here, and here is the young man, a nice looking guy and everything. And you wouldn't know there's a terrible crossbite right in this part of the mouth right there. Now, on the models you can see, and he was missing his upper 6-year molars, and so we decided we would take these out, but I hadn't taken them out right at the first, and we've got this terrible crossbite. Now, there's a lateral tooth in here on the bottom as it broke off the model. Now the central here is in front of the lower lateral, and we have to open this bite almost 1/4 of an inch to get it where we can jump this lateral tooth through this gap. We have to make a gap right there to bring that tooth through. So I opened this part of the bite with a block, and I didn't put one over on the other side. So watch what happens in here and learn something about it. The teeth didn't come out of the bone structure, they didn't get longer, the whole thing just kind of moved together over on the opposite side of the mouth. And this is something you use in orthodontics, and that's what the occlusion or biting down causes it. All right, here's the crossbite. That's the lateral, and here's the central in front of it. And now the lower tooth went up in between this, and I think one of these chipped off of the model, and we just had these marked right here. We were going to take them out so it'd balance up the whole thing. It had some wisdom teeth in there, and we were going to finish the whole thing out. Here's the wisdom tooth, you see, and this is a wisdom tooth. The 6-year molar's gone up here, and we were going to close this together, take this out, and close this together too down here. And then on the x-ray, it's hard to detect this tooth, but it's coming way up in here. You'll see it. Well, here is the tooth right there. You can't hardly detect it. Now, can you turn that air conditioner off there for me? Sorry for that little intervention here. All right, we put a spring in between here. You can see that spring. I'll have to get my little arrow back here again, and or my little dot. And so we've spread these teeth out. I'll have to go back here now. All right, we're going to open this gap right in this area right here. And we've screwed up again here. We're going to open this gap right in this area and bring this tooth through that space. Now, on the other side of the mouth, there's nothing. Now, you could check the times on this. We had to open this young man's mouth about 1/4 of an inch to give us room to pull this through, and we had to push these teeth back here and these forward over here, and we're going to bring that tooth through. And before I could get this tooth into place, these teeth were occluding together. Now they didn't get, you can't look at them and see that they're any different. This whole area just moved together like that, and the occlusion plane would be something like that. Now we got the tooth together and got it in the place. Then we take this block out, and now the young man would bite together, and they touch over on the right side, and the left side had a gap here. There's a whole 1/4 inch. You could stick your finger through that gap. And some people would get really worried about that, but when we did it, in other words, here the block is in place, and we had the crossbite, plenty of room. We were coming through with it, and we took this block off. And the way you take them off, if they're bonded right on top of the teeth, is you cut a groove in it like that, and then pull these sides together, and it'll pop it loose. This is just an acrylic bite plate. It's not bonded on. I mean, really strong at all. And you can take them out, but they stay in there while the person chews on this while it's there. And then when it's gone, these teeth come back together again over here, and these raise up, and the whole bite levels out again. Now, this phenomenon can be used in dentistry to open the bite dentally and not open it skeletally. You put the blocks back here. If you want to open the bite skeletally, then, and you open it dentally too, you can put a block out in here and keep these teeth apart. They'll move together while you're working out here, and you'll increase the vertical dimension of the lower third of the face. In other words, this can grow. Now, a lot of times you get somebody that's got too much of that, and you want to do something to their teeth. You put your blocks back in the back, and they'll constrict the teeth and put pressure on them, And sometimes you can actually reduce the height of the lower third of the face by doing that. Not very easily, I must say. Now let's go. Now here is the opposite side. I mean, it's in contact over here, and this was there to start with, see. Now, we come in and we take that out, and you got a gap over here. Now, as you close to and you know this will go up, and these will come down, and this will level out right across there. It'll just do the same thing. And so I wanted to get this across to you. This is something that you can use in orthodontics, leveling the bite and moving around. We went to school, and they were so you could bite on a cigarette paper and feel it between the teeth, and you could come back with this. Let me see, back in here. Anyway, the teeth will move together like a quarter of an inch. I guess it'd move more than that if you needed to open it that wide, and they will level back up. You don't have to grind off anything, just let them come together, and this happens. So if you're interested in really doing good, super duper orthodontics, learn these things. Just look at them and study them. And I thank you for watching, and I hope you'll join our group. And I'm going to close out now and say goodbye, and we'll close this up.